So, a popular topic is how the gut microbiome may impact inflammation in our own bodies. So, the gut microbiome, again, is built up by all these microorganisms that kind of coat our GI tract and act as a barrier between what we eat and how we feel. And that is limited by what comes through our GI tract or comes through the wall. So, we keep it healthy by eating diverse fruits and vegetables, high fibers, and limited antibiotic use. So the gut microbiome, when it has a big diversity, produces compounds like short chain fatty acids, especially something called butyrate, which is a type of short chain fatty acids, just a fancy name. This butyrate strengthens our gut lining, doesn't allow things through that shouldn't get through. It suppresses harmful inflammation, and it works to suppress inflammation both in the gut and around our body. When the gut microbiome is imbalanced, there's dysbiosis, which is a common term that we see in articles really all over social media and in science as well. It can trigger chronic low-grade inflammation because the good bacteria or the good microbiome bugs are not in control. And this can lead to inflammatory bowel disease, asthma, which is a systemic inflammatory disease, things like autoimmune diabetes, and rheumatoid arthritis. These are all inflammatory states that have been linked to having a less of a variety or a dysbiosis in our microbiome. So the more we learn about our gut microbiome, the more we understand that variety equals less inflammation in our body and our gut. Dysbiosis, which means a decrease in variety or really bad microbiome bugs growing, leads to inflammation and can cause, over the long term, inflammation and inflammatory diseases such as inflammatory bowel disease, rheumatoid arthritis, and cardiovascular disease.